Hi, I'm presenting Module 8 assignment Practice Change Simulation for the course Essentials of Nursing Research. This presentation has the following objectives: identify a clinical problem in home health setting, define heart failure, its demographics, and current plan of care, identify a strategic plan for heart failure management, which is remote patient monitoring versus face-to-face therapy, to critically appraise research study both qualitative and quantitative, implementation of practice change in home health setting, identify Iowa model of care for heart failure management, explore measures to overcome barriers to implementation, identify sources of internal evidence, and identify methods of evaluation. This course has made us select a clinical problem related to what clinicians typically encounter in nursing practice. We utilize a PICOT format in formulating a clinical question. As a nurse in home health setting, I often encounter elderly patients with heart failure. As we know, heart failure is a chronic condition that may have comorbidities such as diabetes, hypertension, COPD, and MI. The U.S. healthcare system is burdened with about $39.2 billion healthcare costs related to heart failure. Heart failure presents itself as a condition that places patients at higher risk for hospitalization, readmission, and outpatient visits. Currently, heart failure is one of the trigger diagnoses for rehospitalizations. About one-fourth of all hospitalizations of home health care patients occur within 7 days after admission to the agency, and 58% occur within 3 weeks of admission. As we know, the goal of home health care is to prevent rehospitalization. Our current plan of care for patients with heart failure is to front-load them in the first episode of care, medication management, case management, disease management, or patient caregiver education, or the CHF pathway. Strategic plan for heart failure management. With remote patient monitoring program or telemedicine, it will provide clinicians with an effective assessment tool in CHF management. We need to identify patient population with primary active diagnosis of CHF and those at risk for hospitalization. We encourage them to enroll, and we refer patients according to program requirements or inclusion criteria. After doing so, we coordinate with the resource person in charge of the RPM program. After that, we can tap the patient into community resources to continue helping them. Remote patient monitoring allows patients with CHF to manage their conditions to prevent exacerbations. It allows clinicians to provide timely and appropriate interventions, thus preventing hospitalization and reduce costs. Research appraisal for quantitative and qualitative research studies. For qualitative research study, the aim of the study was to explore the attitudes and beliefs of elderly patients with heart failure. The study delved on how patients with heart failure view their condition, assess their knowledge of the illness and its management. The study used the term focus group discussion. The research greatly supports the need for the study as it has given the patients or participants a chance to discuss their feelings, experiences, and opinions regarding their health condition. With the knowledge gained from the discussion, the participants were empowered to manage their condition, make informed decisions, and lead a healthy life. With quantitative research study, it was done to show the effectiveness of telemedicine management on CHF patients versus face-to-face therapy in the reduction of hospitalization, readmission, and overall symptom management. The research topic on the benefit of remote patient monitoring program for heart failure patients has shown reduced emergency room visits, hospitalization, and readmission. Remote patient monitoring program enhances patients' active involvement in the plan of care, informed decision, and patient satisfaction. Exacerbation of symptoms is managed through daily weight checks and other vital sign checks like blood pressure, O2 saturation, and heart rate checks. Heart failure management can be done with the use of Iowa model of care, and clinicians are guided with this kind of model of care as it applies research and clinical findings into practice to improve the health outcome of the patient. Iowa model of care for HF management is based on problem-solving steps in the scientific process. It's widely recognized for its applicability, ease of use by multidisciplinary teams. However, there's always a fact or truth that some people resist change. But then there are measures to overcome barriers to implementation, and these are the following: to present the right information done in the right place and at the right time, like what we are doing now. We are trying to discuss the benefit of RPM for CHF management versus the face-to-face therapy. We encourage staff involvement to identify educational content and strategies to learn about the practice change. We need to hold regular in-service meetings, group discussions that promote interaction that may uncover beliefs and negative attitudes, and health coaching, especially for patients, to know what their goals are regarding their health condition. The sources of internal evidence are the following: information learned about each patient as an individual. As we visit these patients each week, we need to uncover whatever the gray areas that they have. Also, we can get clinical's personal experience in caring for the patient over time, discussion with physicians or collaboration with them, information from senior clinical nurses or colleagues, information learned from the training or in-service meetings, and new treatments and medications learned about doctors' prescriptions to patients. How to evaluate if the program is effective? It's done through patient experience or satisfaction. It can be evaluated by means of checking the rate of readmission with face-to-face encounter versus the use of RPM. We can get survey questions from the participants and knowledge assessment through feedback. And these are my references. Thank you.